Hello and welcome to episode 11 of the LiveFitNow podcast. Welcome and thank you for joining me today. I can't wait for you to hear today's conversation. It really is a fascinating one. This is a subject area that I think we all need to start talking about and getting more information on. It is something that just over half of us are going to experience personally. Some may have already been through it, going through it, or will at some point go through it. The subject is the menopause. This truly is a conversation for all. So if you're slightly concerned as to whether this is an episode for you, I implore you just to listen for a few minutes because I'm sure you will find yourself enlightened. This is an episode for men, women of all ages. And I'm joined today by a doctor. She is a GP who specialises in the area of menopause. She shares so much information. We are going to leave this episode being empowered with more knowledge, places to go to find out more, and hopefully start the conversation, because this is what I want to get from this episode. Empower you with the knowledge and start talking about it. So I'm going to leave you now and dive straight into the conversation with Dr. Rebecca Lewis. Dr. Rebecca Lewis, welcome to the LiveFitNow podcast. How are you today?
Lovely. Well, thank you for asking me to join you. It's a pleasure to be here. I'm very well, thanks, actually.
Fantastic.
Yeah, coping all right, thanks.
Good. So glad to hear that. And I think a really nice place to start would actually be if you could tell us a little bit more about your background, why you've chosen to specialise in women's health and particularly the menopause, and what got you here.
Yeah, sure. Well, I qualified some years ago now, 1991 from Guy's Medical School, and initially had a career in general medicine and anaesthetics, a lot of hospital medicine, and then changed to general practice, and I've been a GP since since 2000, and really love my job, mainly because it's a sort of holistic approach to people. It's not just looking at one speciality, it's looking at the whole person, really. And then really as time went by, I could see all these women of a certain age in the menopause really suffering, and got to know a little bit more about it, met up with Louise Newson, who's a sort of leading expert in the field, and learned a lot from her actually relatively recently. And my life has completely changed now, because it is the most rewarding work I have ever done, actually, is looking after menopausal women and helping them feel better. It's, women's lives can be transformed if their hormones are balanced and right. And there's so many myths around the menopause that need to be put right, and so much of society needs to sort of understand more about the menopause. It's a real gap in people's knowledge and medical knowledge as well. Doctors, specialists, general practitioners, the whole of society really probably haven't appreciated how important it is for women, and the future health effects it has, actually, which interests me with my background in hospital medicine and general medicine. How to look after our hearts and our bones and have a fit and healthy life going forward.
Yeah, thank you for sharing that. And I think you're a much better person than I to try and describe what actually is the menopause. What's happening to us?
Yeah, well, so what happens? We're born with so many eggs when we're babies, and we gradually lose these eggs as time goes by, and every month when we have our periods, and we run out of eggs, and that literally is what is happening. The ovary runs out of eggs, but as it runs out of eggs, it stops producing the hormones that are associated with ovulation or releasing the egg every month. So we also run out of the hormones, mainly estrogen and testosterone. Those are the main female hormones produced by the ovary. And the ovary literally stops working, but it doesn't just stop. One day you get up and the ovary doesn't work and you've run out of eggs, unless you have a surgical operation to remove the eggs, the ovaries. So it's a sort of a stuttering stop for most people. It may stop or decrease in its function, and then function may restore for a few months, and then it gets worse again, and then it gets a little bit better. And it's this sort of up and down feeling that we can get, which is called the perimenopause, before we've actually stopped producing eggs, but the function is beginning to decline, and that can precede your actual menopause, when the ovary finally stops working, by 10 years. And the name menopause is difficult because it just means the last period, and it's defined as a year and a day after your very last period. So you don't know when that's going to happen, and it's only a look back in time sort of diagnosis. So it's very difficult to know if you are actually before the menopause or after the menopause. So it's important that women know what sort of signs and symptoms are coming to do with declining ovarian function, or declining levels of hormones, really, so that they can see when changes are beginning to start.
And how early can this begin? I think there's quite a big spectrum of age.
Yeah, definitely. Well, the average age for the menopause, the last period, is 51. But it's a big range. It can be 45 to 55. So within, 10-year age range. But it's really important to remember that 1 in 100 women will be under 40. And 1 in 1,000 women will be under 30. And this can occur naturally for some women, and it may be in their families, it may not, that they're approaching the menopause earlier than they thought they might be. And other reasons, a lot of ladies have had treatment for cancer or childhood cancers, or treatment with radiotherapy or chemotherapy, and this affects ovarian function. So they're put into an earlier menopause as a side effect of drugs and treatments they may have had in the past. Right,
okay. And you did briefly mention them a moment ago. What are the symptoms? What do we need to be looking out for as we're growing older? Because we have no idea when it's going to start.
Yeah. This is the thing. I mean, it's all about. It should be thought of almost like a hormone deficiency, similarly to thyroid deficiency. But when we lose estrogen, the thing is, we've got estrogen receptors all over the body in lots of different systems of the body. And we're all very different, so it affects different people slightly different ways. So most people know that your periods become irregular and then finally stop, and they can get further apart or closer together. And most people know about hot flushes and night sweats. But 20% of women never have those. So if you're waiting for these signs to come and they don't, you may miss the other signs of low estrogen levels, which would be in the brain. Often we get more anxious. There's an area called the limbic system in the brain which needs estrogen to work properly. And when we lose estrogen levels, the limbic system, which is to do with our anxiety and our mood, concentration, memory, fatigue, and libido, is affected, because really estrogen is so important for that to function properly. So we can get more anxious, not sleeping well, libido goes down, memories get much worse. We can't get the right words in the middle of the sentence. Some poor ladies are worried that they're going to have dementia. It's not that, but they can really feel very brain foggy, that sort of feeling, and low and flat in mood is a very common symptom, just feeling flat and low, and women are often wrongly given antidepressants because of that, and that's not the treatment. Actually, it's hormone treatment will help those symptoms. So as well as the flushes and the sweats, there's these mood changes, and they can be very prominent and very severe in some women. Some women can almost be housebound by their anxiety, have had to give up their job because they can't concentrate, or they're so anxious they can't get out of the house. And other symptoms would include very severe muscle pains, aches and pains in the joints, and the muscles just feeling very stiff, vaginal dryness. It's a common problem with pain and intercourse, recurrent urinary tract infections as the lining of the vagina and the back of the bladder are affected by low estrogen levels, and feeling tired all the time. These are the sort of the main symptoms, I would say. Migraines, that's another important thing. If people have had migraines, they often get worse and more frequent, or they may develop migraines for the first time, which is they're very sensitive migraines to fluctuating levels of estrogen. So again, that's a common symptom of the perimenopause for some women. So you can see there's a lot of different types of symptoms.
Yeah.
Yeah.
It's a very broad spectrum, isn't it? And
indeed, yeah.
just for some personal clarity, is it so if, just for example, if the perimenopause going towards the menopause does last 10 years, do people experience the same symptoms for 10 years? Do they come and go? Do they generally just have a few of the symptoms or all of the symptoms? Or what I can imagine, everyone's completely different and everyone has their own experience.
Well, that's right. We are individuals, and that's really important, but it's a really good question, because quite often flushes and sweats can be quite prominent to start with. But then a lot of women sort of, once they're in the menopause, they may still have them, but they're much less intense. They can sometimes fade off. Not in everybody. I've got 90-year-olds who are still having flushes and sweats, would you believe? But some people that does improve with time, and the anxiety may be quite prominent to start, and that may settle or improve over the years. Migraines often are worse in the perimenopause because it's the fluctuating levels of estrogen that are particularly bad, and that can settle down. But we do see how symptoms can be settled. One set of symptoms can settle and another set of symptoms can take over. So it is variable and depends on the individual, definitely, yeah.
I thought that might be the case. And is it a good idea for us to keep some kind of diary or log of our potential symptoms? That
it would be really good for women to know when they're approaching the perimenopause and if they're suffering, because getting the right treatment early on is really beneficial, not only just for us as women, because we're feeling dreadful, for our quality of life, but for our future health. There are plenty of studies now to show that if treatment with HRT is started the earlier it started, the more benefit we get, because that can halve your risk of heart disease if started within 10 years of your last period, which is really important for our future health. It will decrease the risk of osteoporosis, decrease the chance of developing it, and if it were to be present, it would treat it. It's a first-line treatment for osteoporosis as well. And if taken early, it will help reduce all-cause mortality. All causes of death will be a little less in women who take HRT than women who don't take HRT. So that's really important to know as well. So it's our future health as well as our quality of life. So people are having flushes and sweats and not sleeping. It's another common symptom, poor sleep. If that's treated, because the reason they're doing that is due to estrogen deficiency, if it's treated with the right type of estrogen, it can get people back to feeling themselves. People just do not feel themselves. Women do not feel themselves, really. They're not functioning as they used to. They can't multitask. They feel more irritable and more PMT type symptoms before their period. And these are all to do with fluctuating and low levels of estrogen. So replacing that, and that's what hormone replacement therapy means, really. It's simply replacing what the woman has lost with the same hormones. To restore function to her body and help protect her arteries and bones for her future health. So it's identifying something early on and realising there is a safe, effective treatments, and realising what your symptoms can be. And it might be that you start having PMT. It might be where you never used to before, which is just before your period or the first few days of a period, become more irritable, a bit low and flat in your mood, increasing anxiety. You may have a bit of a hot flush or a mild sweat or something like that. Your periods may change slightly. You may always have had a 28-day cycle. As we start to lose estrogen, that cycle control is lost, and they may become a little closer together, for example 26 days, or a little further apart, 32 days apart, something as subtle as that, with increasing anxiety, with PMT, with some flushes, with some sweats, a change in your period, you know, maybe a little heavier, the actual flow, or a little lighter. But all these changes would all sum up to me clinical diagnosis that this lady is starting her journey through the perimenopause.
Yeah, sounds like quite an emotional roller coaster to go through, everything changing.
For some women, not every woman. I mean, 80% will have symptoms and 25% will be severe. So it gives you an idea that, you know, how it does affect women, and you know, sometimes severely, but there are safe and effective treatments for people if they need it.
So you have brought this one up, and I think it would be great just to be able to dive a little bit deeper.
Yeah.
What exactly is HRT? Because I think of all the subjects surrounding the menopause, the little conversation that is around this subject, I think it's pretty much focused on HRT, and women that I have talked to over the last few months have very dividing opinions, and the sources of where they're getting their information from is probably, again, vastly varying. So if you could sort of give us a summary from your standpoint.
I mean, it can really polarize people, HRT. And it's probably really, we have to go back and look at history really. And in 2000, there were some studies that were released to the press too early, which sensational headlines saying increases your risk of breast cancer and stroke. And this obviously is very alarming and would make people feel scared, women feel scared, and their doctors feel scared. But actually we've reanalyzed these studies, and the opposite has been found, in fact. But this message is taking longer to get through. HRT means hormone replacement therapy. So as I said earlier, we're losing, the ovaries beginning to fail. We're therefore, the ovary produces estrogen and testosterone, and as we lose those hormones, we're becoming deficient in them, like a thyroid deficiency. So it's literally replacing the hormones back to a normal physiological female level, back to the normal, not very high levels like the pill, which is much higher dose than HRT. It's just replacing back to the normal physiological status. So women feel on an even keel, so that the receptors have estrogen back in the blood so that the parts of the body can work properly again with the estrogen. It is very safe. We, in our clinic, Newson Health, we always give estrogen through the skin so that there's no increased risk of blood clot or stroke, and it's not, estrogen's not metabolized by the liver if it goes through the skin, so it doesn't interfere with other medications or other medical conditions such as high blood pressure or gallbladder problems or obesity and things like that. So it's incredibly safe to have through the skin. And you also need another hormone if you've got a womb called progesterone, because estrogen would cause thickening of the lining on its own. And to prevent that, we need to have a progesterone. So that's why we need both hormones to take. And that's called combined HRT, estrogen and progesterone. And the reason for giving it will improve the quality at once. It's at the right dose and the right type. And we use regulated body identical, which means it's exactly the same structure as the hormones we produce in our body. So the body likes it because it's physiologically the same, and we have much less side effects, and it's more, it works better through the skin, it's more controllable. So it's a nice way to give HRT, and the benefits are that it improves quality of life, and then would if taken within 10 years of the last period, will have future health benefits on the bones and the heart, and the general, reducing all-cause mortality. So it's very safe for the majority of women, and the benefits far outweigh the risks for the vast majority of women between the ages of 50 and 60. And that's a direct quote from NICE guidance, in fact. So it is very safe. People worry about breast cancer, and that's the biggest thing we find in our clinic. People do worry about all the scares about breast cancer and HRT, and we have to put that in context. We have to say there may be a very small increased risk, but probably not nearly as much as the media have portrayed or what the woman's actually thinking. The increased risk is tiny. It's about 4 extra cases per 1,000 women after 5 years of taking it, which is less than drinking a large glass of wine a night, and far less than being overweight or obese. So we have to take that in context there. If there is a tiny increased risk, and what are the benefits, and looking at our lifestyle choices, there's risk with everything. Getting into a car every day is very risky, in terms of risk analysis. Many women choose to have a couple of glasses of wine every night. Do they realize that's an increase? That's more risky actually of developing breast cancer than HRT, for example. So I think it's discussing that with women and allowing them to make the choice once they know the correct information, and that's the key really, because knowledge is power. And then once they have the proper evidence and knowledge, they can choose, can't they?
Absolutely. And you mentioned contraception, how much actually higher in dose that we have within that. And I know a lot of people will potentially happily take some form of contraception, but maybe against taking HRT. I mean, are the level of risks of taking contraception and HRT very similar in that sense? Are they all quite low risk?
Really, I mean, it's slightly different because there's this different hormone usually they use in the contraceptive pill, and it has to be high enough, so it's a high enough level of estrogen so it stops ovulation, stops egg production from the ovary. And there are more risks with the combined pill with blood clot, because it's an oral preparation, and people with migraine and things, they can't have the combined pill in general, migraine with aura. However, they can have HRT as long as the estrogen is given through the skin. So you can't compare like with like, because although they're hormones, they're different types of hormones and different strengths.
Thank you. That clears that up wonderfully. And so with HRT, if we know that we're reaching the time when this is likely to start changing,
yes,
should we start taking it, or is there a particular point we need to get to before we should consider that?
That's right. So most women, if they're experiencing symptoms that's impacting their life and negatively, they're not sleeping, perhaps they're not concentrating at work so well, they can't multitask, they feel exhausted, they want to go for a nap in the afternoon, that sort of thing. It's stiff and achy. And their periods have changed a little from a 28-day cycle to a 26, shall we say, then yes, I think then we can start HRT. It's perfectly safe to take HRT while you're still having your periods. Another myth is you have to have stopped your periods before you start HRT. That's incorrect. We give HRT during the perimenopause, because often the symptoms are worse in the perimenopause, in fact, with all these hormonal fluctuations. And women will tell you that they feel their mood swings are amazingly, quick and rapid, due to the fluctuation of estrogen and hormone levels. So you can start when you're having your periods, and it's very safe, to take. There's no time limit for taking HRT. That's an important message as well. So some women choose to carry on taking it forever if, due to the benefits on the bones and heart it can give, and their quality of life. But this is something they should discuss every year, really, with their health practitioner, general practitioner. But there's no absolute time limit.
And is there, because obviously it's regulating the hormones, so if you reach a point when you do want to stop taking it, you then have a change when you go from having that regulation of hormones to not. So do you have a sudden change in the levels of hormones in your body?
Sure. So after the age of 60, often we have to reduce the dose because our requirements are much less. If women wanted to carry on but on a lower dose, that would be possible. Or some women want to stop. and that's also fine. And another myth is that, which I certainly thought of as well when I was younger GP, that if you stop HRT, you've just got to go through it all again. It puts off the evil day. Do you know what I mean? So when you stop it, oh, I've got to go through it all again, so I may as well do it now. That's not correct, actually. How long symptoms last is, again, very variable. Between 7 and 10 years, some studies have found. But we haven't really done enough research on that, because in the old days, they really thought more of the menopausal symptoms were hot flushes and night sweats, which often do get better. But perhaps they weren't looking properly enough at all the other psychological symptoms, the muscle pains, etc., which women often adapt to and just put up with, and that becomes the new norm, if you see what I mean. So the symptoms can settle perhaps with some women, and if you stop HRT and there are no symptoms, that's fine. But if you stop the HRT and the symptoms are revealed when you stop it, they would have carried on anyway. It's not because you've put off that day. It's because you sadly were one of those women that would have carried on having symptoms for many years.
Right.
Like I said, I've got 90-year-olds. I've known 90-year-olds who are still having the occasional flushes and sweats. Wow. So some, not everybody, but a small percentage can carry on for many, many years.
And does HRT have a very high success rate? Is it basically almost guaranteed? And if, for example, are there any people that can't take HRT? If it's not a moral choice, just literally they can't. So.
I mean, when you say success rate, I presume you mean people feel better on it or feel, yes. Yeah. So hugely, that's why I love working in this area so much. Women are so, it restores their lives back to normal because they've let things carry on. They may be given antidepressants which haven't worked. They've given up their jobs because they're so exhausted, they can't multitask, their confidence has gone, they're socially withdrawn. And HRT, in many women I've seen, just absolutely flourish and get back, and they know they're back to normal. And so, yes, a huge success rate in terms of quality of life. And the future health benefits as well. So yes, it's safe and it can really help women, which is the message I want to get across. Really, if you're suffering, there's so many. This is a really good, simple, safe solution.
I think that's very reassuring, and it is all about education, isn't it? Just so that we have that awareness of what the options are, what we might be going through, and also having a conversation and talking to other people about what you're going through. And I think it's I'm not sure whether we shy away from talking about this subject. I think perhaps puberty and pregnancy is more widely discussed amongst women, perhaps again not across society. But it seems to be, for some reason, the menopause, although I think again it's slightly changing, it's sort of brushed under the carpet. You just kind of you're at that point of being past it. No one needs to talk about that. Or it just what happens and we just move on. Yeah,
that's right. Things have changed, because I don't think they talked about childbirth perhaps as like we do now, perhaps in the Victorian times, but we've managed to change that, thank goodness, and people are able to talk and express things. Mental health we're talking about much more now as well, aren't we? The menopause is still lagging behind, but we are improving. It's societal changes which are coming. But if you think about it, in a way, it's a bit of a new phenomena, because if you look at the average age expectancy in the Victorian times, say 100 years ago, it was 59. Well, the average age expectancy of women now is 83. So we are now, only this last generation or two, seeing women living to a longer age, and will be in the menopause. A third of their life will be spent post-menopausal. So we're now seeing the effects of living without estrogen much more is coming to the fore, and we're realizing how important that hormone is for our functions generally all through the body. And that's why it's become more of an issue for our generation. Because we now know, we've got more research, we can see why it is important. So now we know that it's getting that message across to society, because before it wasn't realised that it was an issue, and women, you know, perhaps they weren't working, so they could have a sleep in the afternoon because they were so exhausted and tired. You know, the society, they adapted to their circumstances. It was that their lifestyle allowed them to do that. However, now we all have high functioning lifestyles, no matter what you do, or, you know, you don't have to be working, you can just be you know, doing anything. But our information overload from the internet, it creates, you know, we have to function quickly and well and be on the ball all the time. And so now it's more obvious when we're in the menopause, because we can't perhaps concentrate as well, and it's difficult for women.
So it's a relatively recent discovery, I guess, in a lot of ways, that it might have just been something some women, if they were reaching that age, were experiencing.
That's right.
Just thought it was something that happened. They weren't really talking about it to sort of put it down as something that happens to every woman. So it's happening very quickly, I guess. And it's interesting really to think that if it wasn't for the fact we have changed so quickly, as you say, if you know, perhaps 50 years ago there were a lot of stay-at-home mums, so they were all women that were housekeeping rather than out for a job, so they could have the mood swings, all of those symptoms.
Yeah, that's it. It might not have impacted their colleagues at work, or, you know, they still work very hard, but they could perhaps flex their day, so they could do more of the cleaning and housework in the evening, for example, and had a nap in the afternoon. But it's, as you say, it's changed so much, society, and the 45 to 55 is the biggest sort of subset of women working now. It's a really huge amount of women who are working in that age group. So it's important for bosses to understand this, because I see a lot of women just having to walk away from their job, or, you know, decrease their hours, because they're feeling so dreadful, which they don't realize is due to their menopause, probably in many cases. So actually it's really important in the workplace to help women, because these are highly trained people, but by the age of 45, you know your job pretty well, you've got a lot of experience, so it's really bad economics to lose these highly valuable, skilled women, but that's what's happening.
How do you think we can get this conversation going more? Do you think it is about going into workplaces? You know, is it people? We are
going into workplaces quite a lot and talking to people, and there are things, you know, the menopause policies are around, but it's good to talk. It's good to get the awareness up, but actually we want solutions, really. That's the key. You know, identify the problem. Okay, we understand now what it is, but what are the solutions? And that's the key thing. And the main solution is HRT, because that is getting to the root of the problem, which is the lack of estrogen. There are alternative treatments. We discussed about HRT. The vast majority of women, it can be taken safely, even with coexisting illnesses, especially if it's through the skin. Obviously, people who have estrogen dependent cancers, that is a different case, but every case should be looked at individually. And there are alternative treatments for some people. Sometimes we use antidepressants actually for hot flushes that can help hot flushes. CBT for anxiety and for hot flushes has been shown to help women too. Regular exercise, getting a healthy diet, making sure we've got enough calcium in the diet. At the time of the menopause, we put on weight around the middle, which is not good for our cardiovascular system. And so, you know, being aware of that, eating healthily, exercising, really vital, again, for our mental health, our physical strength, and weight-bearing exercise to help prevent osteoporosis, which that rapidly increases after we've lost our hormones, the risk of osteoporosis. So it's looking at the whole person and getting their exercise regime going, their diet, controlling the weight around the middle, etc., is really important as well.
And are those methods can they work for some people, you know, if they want a more
Yeah, they
holistic,
can.
non-medical approach?
Yeah, they can. Certainly, you know, the antidepressants for hot flushes have been proven to decrease those and help reduce that. But they won't really help all the other symptoms of the menopause. That's the thing. It won't help the muscle pains, the vaginal dryness, the mood. Really, it doesn't really help the mood, because it's different from being clinically depressed. It's a low, flat mood. And it won't help libido. In fact, it makes libido, which is usually lower in the menopause, it makes it worse, antidepressants. So yes, they do help a bit, and some studies to show that, but I'm afraid to say it's HRT again is the main thing that helps. I mean, it's vastly superior to any of the other treatments in terms of effect.
Would you recommend people, if they, you know, are approaching it or just want to go into a little bit more detail about it, is it a good idea just to literally make an appointment with your GP to have a chat? Or do you think it is actually better to try and find, whether it be within your surgery or elsewhere, someone that's a bit more specialist in the area, so that you can really get all of the nitty-gritty details, so that you feel like you're being able to make the right choice?
I think the general practitioner is that, or the nurse practitioner often in general practice, is a really good source, and many are very well trained and to recognise symptoms of the menopause. I think reading behind it is always good, because you want to be informed. And where we work at Newson Health, we have Dr. Newson has got a website which is not pharma funded, it's totally independent, it's evidence-based website called Menopause Doctor, and there's loads of fantastic information about menopause, about HRT, about what would you do if you're young or if you're older, if you have other medical problems, can you take HRT? All this is there, and it's a very useful resource for women and healthcare professionals who find it really helpful as well. And there's actually an easy prescribing guide there for suggestions of the best type of HRT to have. So I think that's a really good first stop. There's also something I find really helpful in my practice, is something called the Green Climacteric Score, which is on this website, and it literally lists all those symptoms we were discussing at the beginning, you know, the flushes, the sweats, the poor sleep, the muscle pains, and it lists them all, and you tick out how much you've got and the severity of each one. So if you went to the GP with that, I think that would be very helpful for the GP, because they could see, oh yes, there's lots of symptoms here, all measuring up to looking like this is due to the perimenopause or the menopause, and then you get off on a good start, and you know, you're talking about hormones and helping, and what's happening to your body, and how things can be given to help.
Great. I will add links to those in the show notes, so people can click through and do a little bit more research.
We're developing an app which is coming out next week, which is really exciting. It's called Balance App, and that's Dr. Newson has developed that app, and that's a free app, and it's discusses all these symptoms we've just mentioned. It's a chance for women to have a forum, a safe forum, to talk with each other about their symptoms and solutions for their symptoms. It's tracking the periods, giving advice as well, and looking at all sorts of things: their exercise, their diet, their skin, all these sort of things. So it'd be very helpful, hopefully.
Yeah, it sounds really comprehensive. And unsurprisingly, we've obviously focused on women, but actually I kind of want to bring men up. Do you think we need to start talking to men about what we're actually going to be going through? Because this is why I've been so looking forward to this conversation, because it's madness that something that literally will affect pretty much the whole population barely knows anything about it, because half of us are going to go through it and the other half are going to be putting up with someone or other going through it. So we need to get talking.
Exactly. The men have got wives, girlfriends, mothers, sisters, etc. And so yes, absolutely, it's society in general that need to help in understanding what's going on. You know, in the workplace, for example, why some women may be struggling when they never have before. Definitely we need to open dialogue and help understanding. In relationships, it's hard. If the woman's really suffering with the hormones, feeling irritable, the libido's gone down, that can alienate their partner. They can feel, quite rejected perhaps. And if they understand perhaps why, that can just help, communication between each other as well. Because it is quite hard to communicate when in some people have significant symptoms, because you feel quite shut off and blunted and a bit flat. And you feel, even from your loved ones, you feel a little bit aloof. And just in your very, very own world, and you don't want to be, but that's how it can feel. And so, the physical side of the relationship has also been affected. It can cause a gap between couples, and it's really important that the men are aware of what's going on as well.
Yeah, I completely agree. And
really good point.
And the thing with the workplace, because I can fully imagine that, there's obviously a lot of talk about equality in the workplace and all these things, and women trying to build themselves up over the years. And then they reach this point where they aren't feeling themselves. They don't feel like they're functioning 100%. They know they're not doing their best. They're doing as best they can, but they're not necessarily functioning at their best.
Yeah.
I think it's a really hard thing to put your hand up and say, actually, I'm not coping. Like the situation of this setup isn't working for me. And to put your neck out to say, actually,
this
isn't, something needs to change. I think it's really hard.
I agree.
I mean, do you think, I'm guessing it's a big part of your clinic, and there's probably clinics in other parts of the country, something like getting in touch with you and passing your information on to HR or something like that, to try and arrange, if there are currently no policies in place, how you can kind of bring it up without feeling like saying, oh yeah, I can't do my job properly. It's a really tricky line, isn't it?
Well, it is, and you've touched on that really important subject. But actually, there are advice from unions, Unison, and Faculty of Occupational Medicine, and many other unions about having a menopause policy, so that we try and normalise this, so that it's not, you don't think, oh gosh, I've got to say, and no one will understand. If it's made more transparent and we can talk about things more easily, you've got a line manager that you could talk to, they should be trained, and that's what that they're trying to achieve, the unions and Faculty of Occupational Medicine, so that people feel able to talk about their symptoms and why, they may have to take a change of clothes, something as practical as that. They may need to be near a loo because the periods are so heavy that they need to get to the loo so quickly, or they have to change clothes because their sweats are so bad, and they need a fan, and they need more time because they've had no sleep, so maybe if they start later in the day, things like that, little things but important things to say, yeah, I know you're suffering, what can we do to help your day go better? It goes a long way, and it's important that dialogue is just started, I think, and that women feel able to talk to their managers about, look, this is what I've got, this is the problem, can we find a solution here, given this? And that's a really important point, actually. And so, yes, a lot of women, but historically, of course, a lot of women have been signed off sick, and we did a survey about how many women have been signed off sick with menopause, and at least 50% have been signed off sick for more than 2 weeks, but none had put menopause on the sick certificate from the GP. It was anxiety or work-related stress, that sort of thing. But we need to validate the word menopause, and it is something that happens that can, have really serious symptoms for some women, and the workplace needs to be aware of that and look after its staff.
Yeah, it seems that communication really is key with this area, isn't it?
It is. It's education and communication. Yeah, definitely. Yeah.
The more we talk about it, the more we break down those barriers, hopefully.
I think so. If people can just talk in a normal way about it, and in the end, it takes time, but things are moving. And there are, the people who can come into workplaces to talk about menopause in the workplace, which I think, is really helpful.
Yeah. And do you talk to men and women, or is it usually just the women?
In the clinic,
no, if you go into workplaces.
in the workplaces, no, it's managers. They tend to be invitation lunchtime meetings, so there are more women, but quite often some men come as well.
Oh,
it's so important that they do, because they may be managing someone, or they're a colleague of someone. They're going to be impacted.
They are.
And just having that knowledge, kindness and knowledge is will go a long way, I think.
Yeah, it's breaking through the squeamishness, isn't it? I think quite often a lot of people just like clam up, and men and women, it's not actually just men.
Yes.
Will just clam up and think, oh, this is awkward, I don't want to talk about this. And we just need to keep pushing through until there's plenty of subjects we talk about now, see on the television that even 10 years ago we wouldn't have seen.
No, exactly.
It change quickly. It's just sticking with it, isn't it?
Yeah, we feel we're quite advanced. We can talk about anything, but actually, periods and hormones, people clam up, but we must change that.
Absolutely. And also, rather than bottling up these feelings and symptoms, which I think is only going to make us feel worse, if we're discussing it with other people, realizing actually other people are experiencing the same things or similar things or worse things, it can put things into perspective for ourselves and actually make it feel more like we can cope with it, rather than just bottling up, trying to put a brave face on.
If you're the only person going through it, it makes it so much harder to bear, doesn't it? But actually, as you just said, if you realize that actually a lot of other people are suffering in the same way, that's a start, isn't it? That makes you feel, right, okay, I'm not abnormal, I'm not having dementia, because that's a lot of people think they're going to get dementia, or they're having a terrible depression they're never going to get out of. It's knowing that actually there are people going through with it is really helpful and supportive. It's that support, that's what people, not feeling so isolated. That's the thing.
I mean, the app sounds like it's going to be great, but are there any, sometimes people struggle to start with the people closest to them, so maybe are there any sort of online forums or apps or particular pages or places to go that might just get the conversation going that's easier when it's further?
Not an official one that I can think of at the moment. There are Menopause Support is a good website. Diane Danzebrink runs that, and she's brilliant. And that's a lot of people can go on there and find that very helpful. And I think getting a forum of trusted people that can discuss symptoms together it is very helpful for women, and actually have a solution. Someone, if they're steering that conversation, who has got a lot of knowledge about the menopause, can steer these women in the right direction. And there are lots of support groups, vaginal problems, vaginal dryness. Jane Lewis runs an interesting group for people who have suffered with vaginal problems, and lots of sort of places like that. Which can be helpful for women.
I think it's for a long time, I suppose, we just had to put up with it. And I think perhaps there are still people that think, oh, that's just what happens, we have to put up with it. But I guess what you're saying is actually we do have a choice. There is an option that can minimize the symptoms that we would be going through. There's no need to just cope or deal with it. We can have another alternative ending.
That's right. And there's you never get your hormones back, and it's an abnormal state to be in many ways, because we weren't designed not to have estrogen, really. Thank goodness we are living to 83, but one of the things we're missing is our hormones, and that will help our heart and our bones. And so it's not just coping or not coping, it's actually thinking about our future health and being sensible about that. Similarly, eating a healthy diet, exercising regularly. We all know we're doing this in part, number one, to feel better of our mental health, but number two, is also our future health, isn't it? To look after our hearts and what have you. Well, HRT is the same sort of thing. It's not about lack of coping. I need HRT therefore because I'm not coping. It isn't. It's about improving your quality of life, not being a victim, but it's actually right. This is the solution. I'm feeling not good. The solution is this. Let's do it. So I can perform. I can function. I can get back to work. I can then exercise because my muscles aren't aching. Because it's very difficult to exercise when you're exhausted and have a lot of muscle aches and pains. So you can exercise. So I'm doing something proactive to look after my future health as well.
Yeah, absolutely. Longevity, but with quality of life.
Yeah, that's right. Exactly.
And I guess I want to have a bit more of a positive sphere around the word menopause, because I do feel like there's a lot of negativity. Like it's the end. Like, is it as bad as it sounds? Like during might not be great, but actually afterwards, is it good?
I think it's brilliant when women are back on their hormones. You know, it's they are feeling fantastic. It's a great time of life. You know, often it's a time for you really. You know, if you've had children, perhaps have grown up and that you've got more independence now, it's you may be at the top of your career or feeling very comfortable with your job now. You've got the experience, you've got the confidence. You know, it's the second phase of our lives that is fun, it's exciting. Some people have career changes for new careers that are stimulating and interesting. You know, it's living life to the full, enjoy life. You know, so they perhaps start exercising more, or sport, new hobbies. You know, it's having that interest still in life, and that enjoyment and that excitement of life still. If their hormones are balanced, they will have that. And so yeah, it's living life to the full, I think.
I love that. I have a question. I'm not sure if it's slightly out of your remit, but I'll ask you and just say no if it is.
Okay, yeah.
Do men go through any kind of similar process? Because I know their testosterone drops. So is there the hormone change?
Yeah. Testosterone deficiency is out of my remit. So I will just say that, yes, you know, the andropause or testosterone deficiency is a condition with men. It's less common than women. I think it's about 10% of men can suffer with low testosterone levels. But yeah, that's somewhere someone else probably needs to more than me.
I thought I was probably pushing the boundaries, but I thought I'd ask.
Yes, it is, and it's important actually because that has effect on their heart and you know, well-being and future health as well. So it is important that that's checked out too.
I think it's really important that it's very much what this podcast for me is about. It's empowering people to take notice of themselves, how they're feeling, what their body's doing, and actually you know, feeling the change, seeing what's happened to it, rather than just being numb and not actually realizing and just blanking out symptoms, because it's very easy to do, particularly if you're scared of what is coming.
Exactly, or what the solutions are, which when you don't often need to be scared about them because they are so safe. But yes, it's not denying your symptoms, isn't it? It's not being a victim. It's not, we don't want, you know, that's not right, but it's understanding the symptoms and then thinking, right, well, I know there are some solutions and I've heard that they're safe. I'm going to do my research. I'm going to find out about them and then I'm going to decide.
Absolutely. Empowerment.
I think so.
I think you probably brought up a couple, but I thought I would just refocus. Are there any common myths, I'm sure there are lots, linked to the menopause that you would like to debunk?
Well, I think we discussed the breast cancer, you know, problem really. I mean, there is maybe a small increased risk of breast cancer, but it's much less than people are aware of. And looking in the whole context of HRT, you know, the other risks of breast cancer are higher. You know, the lifestyle risks of the drinking a glass of wine a night is higher risk than HRT, and being overweight or obese is much higher than HRT. I think giving estrogen through the skin is vitally important way to give HRT, because if you have coexisting illnesses like migraines with aura, or blood pressure problems, or have had a previous clot even, you can still take HRT through the skin. So that is a very safe way of giving HRT. Also vaginal symptoms, and that's a more delicate subject, but so common. Vaginal dryness and soreness and irritation are really common, and local estrogen, little pessaries of estrogen, can be placed in the vagina, and that can really help women, and that can be used very safely alongside the systemic HRT, as we call it. So that's another safe thing to use. There's no time limit if people are feeling the benefit from HRT. It's something that should be individualized and discussed with their doctor. If taking HRT has helped them and they wanted to continue, there are some benefits for continuing HRT in the long term for many people, and that needs to be discussed on an individual basis. Yeah,
thank you. And do you have any hopes for the future of what menopause is, of challenges being faced at the moment, or can you see any challenges that
I'd love
are coming up?
Yeah, I'd love society to change soon, and we are seeing changes. So menopause, as you said, it sounds a bit depressing, a bit dried up, washed out, over it, is the narrative, isn't it, so far? Yeah. I think we can change that to, this is an exciting time of our life. It's a new era. There are less perhaps restrictions, or less ties from before. It's a chance to look to our future and look after our future health, and be physically active, not sitting at home sleeping with your slippers in front of the fire, that sort of level. We need to show, look at Elle Macpherson, look at all the supermodels in their 50s, have them as role models in the menopause, really. That's what we need to say. It can be full of life, and good time for women can be sexy, all these sort of things,
Yeah, I mean, realistically, for some people, they might only just be hitting the halfway point of their lives, and they live half of it miserably.
That's halfway through. That's right.
Definitely not. I think I really do find, more often than not, barring severe illness, age is a mentality, and I think you can choose to feel old, and you can choose to stay young. And I love it when people choose to stay young, because you can do anything. I've got a lady that I train. She's in her 80s.
Fantastic. Yeah.
There's no need to stop.
No. Inspiration, isn't she? Probably.
Absolutely.
It's, as you say, I completely agree. It's an attitude, and if your hormones are balanced, that helps, because you're not feeling achy and stiff, and you do feel old when you feel like that. It gets your body feeling more youthful, I suppose.
Yeah, absolutely. And again, you've probably touched on a couple, but do you have any general tips or advice that you generally give to people that is good for their overall well-being? Things that, here's HRT, but also do this.
Yeah, I mean, many women choose not to take HRT, or because they've got an estrogen dependent cancer, it's not advisable. That's the situation. So there are other things as well to look at apart from HRT. But also, I say, once you're on HRT, women have been struggling with, and you'll see clients like this, and really trying hard with their exercise regime and their diet, and they're trying to lose weight and trying to eat healthily. But actually, when the hormones are low, you get these sugar cravings because you're tired, and carb cravings. So that's really difficult to counteract, I find, with some of my patients. And the muscle aches and pains, the fatigue, very hard to exercise regularly. So I've often have, we always go about how important lifestyle is. But if you can't manage that, actually, once your hormones are balanced with HRT, then the lifestyle, women can then concentrate on the lifestyle. So it's very common scenario. ladies have been a little bit overweight. Once they're feeling happier and stronger, and not so exhausted, they've lost weight and they come back and say, oh, I've done couch to 5, or I'm starting running, or exercising in different ways, and I was drinking a little bit too much alcohol to numb my symptoms, quite frankly. And now I've managed to stop that. So I've reduced that risk on the breast cancer, and I've reduced my weight because of that. So the actual lifestyle improves so much because they're mentally in the right place. And then physically not hurting, and they're physically not absolutely exhausted all the time. So then, changes happen.
I couldn't agree more. And you can see that so clearly, because obviously there's so many triggers in life. If you're waking up in the middle of the night or getting very poor sleep, you're tired all the time, and then you're going to be more hungry, and you're not going to want to exercise because you're tired. Right. And then it's a constant spiral, and
it is.
You can't make yourself sleep if you're suffering at that time.
No, you
have to try and address the best way for you to deal with it.
Yeah, that's right. It's looking at the whole person and the individual, of course. But weight-bearing exercise, calcium intake in your diet. There are calcium calculators online. They're quite good to make sure we're getting enough. And vitamin D, we should all be on vitamin D because that helps absorb the calcium. We don't get enough in this country. So that's the general advice, the general guidance is that we should all be on very low dose vitamin D. So,
excellent. Thank you. They're really useful tips. And
good.
I'm going to ask you a broad question next.
Yeah.
And it can be linked to your job, or this can in fact just be a generalized, what inspires you?
Well, I think, people inspire me. My patients inspire me, actually. I see women who haven't been able to, move or exercise, and, once they're right, they're doing amazing things, and running marathons, or you don't have to run a marathon, but managing to get out and socialize, and they haven't been out of the house for 5-10 years, or they're starting to drive again because they've stopped driving because they're too anxious. And you have stories like that all the time, which are really inspiring, actually, because that took great courage for the woman, number one, to come and see me because she was so anxious. Number two, to, take some medication because she was so anxious about it. And then she feels better. And I think that took guts because of her anxiety. There was nothing really to be anxious about, but in her mind, it seemed very frightening. And, they have really managed to change things. So I think people are always inspiring. And, that the lady who is in her 80s and she's keeping fit, and it's the attitude, isn't it? And she's constantly exercising, and she's got a great attitude. And I think it is all in the mind, isn't it? The aging is how you feel, not your number of it. That's what I think, anyway.
I think that's lovely. No, I completely agree with you, and it's true. And seeing people from all different backgrounds and different experiences, and I guess they almost get stuck in a cage, and then once they get out again, they're ready to push their limits.
Yeah, it is.
See what they can do.
Or, yeah, exactly. Or just be back to themselves, which is so rewarding, and that's really nice. Yeah.
How long on average, I mean, this is obviously a very difficult question because I know every client is different, but do people usually experience symptoms for a particular amount of time before they feel that they just have to reach out and get some help? Or do you have people that come in sort of early stages?
Very variable as the message is getting out. Some people are coming earlier with slight change in periods or PMT and a few symptoms, and have done their reading and think, actually, yeah, I think some changes are happening. I can feel my body. They're tuned into their body quite well. I think there's a change. And, really, my mum had osteoporosis, or my grandmother had osteoporosis. I could see how devastating that was for her. And I really want to look after my bones. So I'd like, to discuss this. So some people are coming quite early. Traditionally, a lot of people, put up with things for years and years and years. And it can be more difficult and take longer to improve, but they will, and HRT usually helps them very nicely. So yes, people are coming in all phases of their transition, if you like, in the menopause.
Yeah. So is osteoporosis directly linked with the drop in our hormones?
More women, men get osteoporosis too, but many more women get osteoporosis than men, because estrogen is one of the most vital things to build bone density. And it's important to know what osteoporosis is. It's the structure of the bone becomes thinner, more porous, so more fragile. It doesn't hurt. So it's not like osteoarthritis, which is the joint inflammation and pain of the actual joint. It's the bone structure becomes more moth-eaten, if you like. It can become like honeycomb rather than being tightly packed. And estrogen is really important to keep that bone density. It's not the only thing, but it is really important. The risk of osteoporosis is very, very low until after the menopause, and then it increases dramatically without estrogen. And HRT is a first-line treatment for treatment of osteoporosis because it helps build up the bone. So osteoporosis, 1 in 2 women over the age of 50 before they die will have osteoporosis. They may not have 1 in 3 will actually have a fragility fracture over the age of 50. So that means just a gentle knock and a bone breaks, and it may just be a small little bone in the hand or something, but it could be a larger bone. Yeah. Hip fracture is very, very common in men and women, but more common in women because we've lost our estrogen, which is more protective in our bodies. There's a mortality risk with that after a hip fracture in your 70s or 80s. Yeah. And if you do recover from hip fracture, 80% become dependent at some level.
It's the muscle wastage then, isn't it? At that point,
the muscle wastage, and yeah, that's right. It's very difficult to get back, and balance has gone, and because you're in your 80s in general, so it's vital to keep our strength up, which is what we're all about, and functional strength, isn't it, as well, and day-to-day thing. So it's a huge problem. It costs NHS billions a year.
Yeah, I think it definitely is coming up, and I guess it's bringing these things together because a lot of my clients actually are sort of in their 40s plus, right across the board, and there's a lot more older people obviously being educated to the fact that they need to be doing some sort of resistance training, whether it be weight bearing or lifting weights, and the fact that shift has happened shows that it can all start coming together, and people realizing, I think, how it all links. It all interlinks really for our overall well-being.
Yes.
Just we don't realize there's lots of little bits that are affecting us in different ways.
That's right, absolutely. I know. We're not just one body part, are we? We've got to look at the whole person, the diet, the exercise, the muscles, the internal mechanisms, really. Yeah.
I think people always want the simple magic answer that you just have to do one thing and that's going to happen.
No, it's not like that, really. It's not like that, is it?
It's not. It's a constantly evolving process.
Yeah, I agree.
So just to start wrapping up, I would like to finish off by giving you the floor to share one thing that you think everyone would benefit from knowing.
Oh gosh, well, I would say live life to the full, and don't put up with symptoms when it's actually, there's some very safe, effective treatments that not only help your symptoms but your future health, which is important. That's really what I'd like to get across.
And that's lovely. Very succinct. So I really, really like that sentiment. And I'd also just like to give the opportunity, is there any way my audience, if they want to get in touch with you in any way, or do you advise just contacting your GP, or perhaps going to the Menopause Doctor website?
Yeah, I think all of the above, really. The Menopause Doctor website is really good for information there, unbiased, not pharma funded information, to get you started and get you reading. Knowledge is power. And I think, having a conversation with your GP, perhaps saying, what if you think it's hormonal, you can download that score I was talking about and show what your symptoms are, and then have a conversation with GPs who are really great at helping. And so that would be my first port of call. And we have a clinic as well, which gives women more time. And I'm a GP as well, so it's very difficult, 10 minutes, isn't it, to discuss everything. So our clinic just gives more time and expertise. Not all women need that. Some women want it, some women don't. It's a private clinic. It's called Newsom Health, and people could just email there, go on the website if they want to find out any more. That's all. But general practitioners, really helpful, and the Menopause Doctor website I would recommend.
Thank you so much for your time today. I have absolutely no doubt that people are going to love this conversation, and hopefully I can get lots of men and women talking about it and thinking.
Good. Oh, well, no, it's a pleasure. Thank you for inviting me.
Thank you so much for listening to episode 11 of the Live Fit Now podcast. I really truly hope you enjoyed that conversation as much as me. I have been so looking forward to recording this conversation because I think it is a really important subject, and hopefully now you've listened you agree. So it's really time to get the conversation going. I will pop all of the information, including the app and the websites, so that you can empower yourself further. It's time to get the conversation started. Men and women, we all need to hear this. We need to know what's coming, we need to know what people are going through, and we need to help each other. So thanks again. Please don't forget to share the podcast with your friends and family. The more people we reach, the better. And it's a really wonderful way to support me and the podcast so that we can keep growing. You can also subscribe to the channel so that you know when the next episode comes. And it is also a really great help if you can share on social media and review on your platform. Thanks again. Until next Thursday.